anything where you're expanding the inhale, sort of technically a Brahmana breath. So the sort of the simplest version of Brahmana breath is having an even inhale and exhale. So a lot of people teach that, and they teach it as kind of an even breath, but it's not, because your exhalation is normally longer than your inhalation if everything's going well. So that's like a slightly stimulating breath. And then the next step from there would be to add a pause after your inhalation. So, say, imagine an inhale for 6, a pause for 2, and you could start with like an exhale of 8. So you have that pause in there, and that's an even breath as well. And then you could further expand that if you wanted. Now, the only issue is that Brahmana breaths can, while they're invigorating, they can also produce anxiety. So if she's fresh off of she's in mourning, basically it's not always the best choice. And also, but you just want to kind of monitor that. Like, you don't want to push it so far that she kind of tweaks herself out, as you do those holds longer and longer. And the other thing to think about is you wouldn't want to do a Brahmana breath that's all chest breathing, because you never really want to be all chest breathing. So you want to make sure that she's using her diaphragm appropriately, because otherwise she'll get a kind of bigger nervous system response, right, from that chest breathing situation, and that can cause anxiety as well. The other way you might want to work with it is to incorporate those ideas into moving and breathing. So things like Warrior One, or kind of like rolling bridges with your arms coming up over your head on the floor. So you like inhale, lift your arms, and then pause, and then exhale. Those work pretty well. I generally prefer those to pranayama standalone, but you don't have to. There's no set ratios, because people breathe really differently. So you might notice I don't do a lot of counting, or some people take to that well, but you really don't want somebody really pushing against their breath limits. So you want them kind of naturally expanding. So usually when you're working on that, you go in stages, which is inhales and exhales even, then inhales longer than exhales, and inhales and pauses that are longer than the exhale. So you're sort of like kind of gently working up, finding where you can work comfortably. And then when you're exiting the Brahmana breath, you want to go out the way you came in. So if you've worked up to inhale for 8, pause for 4, exhale for 6, like a big Brahmana situation, you step it down to whatever came before that, and then you step it down to whatever came before that. So you don't just end on the Brahmana and just stop. And that helps people kind of walk out of it without feeling bizarre mentally. I will tell you, in clinical practice, it's very rare people are doing really big ratios. For most people, if you inhale for 8 and exhale for 6, say, or something like that would do it, that would do it. So you can experiment with the longer inhales versus the inhales and the pauses. Yeah, with this kind of thing, though, like, you can do a lot. Like, if she laid down and did that bridge with all these holds, I remember doing that with Mark Whitwell. It's probably where I first did breath work like that, and years ago. And he put us on the floor and we did 28 breaths. It took a while. So you'd have a lot of options, or an easy option is like a Warrior One, right? Because it's a back bend too, and working the breath there, and just have her do that. So you're sort of like getting your body into the pranayama. That's worked really well for a lot of people I worked with. We just talked about this yesterday. I did a final interview with Christine Sari. You'll see it. She graduated, and she presented a depression client who did really well. But they had a system where this person was supposed to text her every, I can't remember what it was, 2 or 3 days, and tell her what she had done. But she needed the support. And I usually do stuff like that too, because it's sort of a given that the person's having trouble doing things. They're depressed. So they're going to need a lot more support than another client. So, and the other thing with any kind of habits is you want to tie it to something else. If you tell your client to do this asana sequence, it has to be tied to something like before breakfast, or when you get home from work, or after you brush your teeth, it doesn't matter what it is, but all habit change research has shown that that is maybe the most important thing. There's something you're already doing, and then you're adding, this task. You're connecting to this task to something your brain's already got neural pathways for. So if you kind of just send your client off and say, do this 3 times a week, it's not going to work because they don't have like a system. Well, that's why it's important to have like some like kind of definitions of like chronic grief versus grief. And, generally as yoga therapists, we work with chronic grief. I don't know. I mean, I'm part Jewish, that's like a year before you put up a headstone. Like there's like a ritual, and makes sense, right? In a year, you've gone through every holiday, every season, and nobody, kind of the purpose of that is like nobody is sort of encouraging you to kind of get back to it before that time. Nobody's like, you should date. You know what I mean? Like people say crazy stuff, while somebody's actually grieving. But it's also a nice, I think it's a nice way to think about it in terms of like where one might want to be. If one's a year and a half later in their house with their shades drawn, you might have a problem. The grief is like taken over, but you're gonna have some big moments. Not that a year is like a definitive thing or anything, but it's nice that even exists as like a paradigm. When you're talking about it just as a yoga therapist, you don't want to say we, because there's a lot of different people, right? There's a lot of different communities, so many cultures, like in the US and Canada, there's just so many cultures that I think the interesting thing is on that, interesting thing is that there isn't a cohesive culture, right? So you're right in that, like there's not a thing that we all do together. People are in these little, there's people with no anything, and there's people in these tight knit communities, and it's all very confusing. I sort of feel the same way about food. There's no like diet that we're all eating, right? Like most places, people eat the same thing. And grieve in the same way. Like these are what cultures do, but like I'm agreeing with you. I'm saying like in ours, it's like so fragmented. So the ritual is really there to give somebody. It has several purposes, but the big one I think is that you give somebody a place to experience their emotions, because like you're saying, you're walking around the world and it's sort of like you're half in, half out. To have a ritual around your grief where you have like a moment, right, to experience your feelings. And with chronic grief, it gives you the ability to put it away, because you have to learn that too, right? Like, so you could put it away, go do what you need to do, knowing your brain, you and your brain together, like know that tomorrow you have this ritual waiting for you, and it doesn't sort of just leak out. This is for chronic grief, right? People, I've seen people like 8 years in, that are not functioning well, and it's because they've never sort of developed that ability, especially if you have like really big things. I mean, everyone responds to things differently, but like if a child dies or something, that's just like really complicated. I don't usually recommend you work too much with people that are like in their grief process. I mean, people can certainly do yoga and go to yoga class and all that, but in my humble opinion, just kind of allowing people to go through their process. A lot of times people will come, they're hurting, so they'll come early on. It's really not a great idea. It's like they're raw. You're getting into a relationship that isn't really in your scope. You're not a therapist, like a psychotherapist who might, if they do grief counseling, for instance, might have some things to say. Usually the way I kind of think about it is there's that ritual thing, and also like getting people back in their body. Like when people have numbed out from pain, there's a point where they have to reintegrate. So, another way to look at the grief is that it's a trauma. That's something I think about. And even if it wasn't a traumatic death, but it can be really hard for people to like sort of accept and integrate that. So people can get very disconnected from their bodies. So often that's very useful, but not too soon. My message to people is usually you're okay. You're experiencing grief, and that's unpleasant, but that doesn't mean you're not doing it right. Because it's easy if you get in there too early to sort of give someone the message they should be doing something different than what they're doing, and that's very tricky in early stages of grieving.
Buddy.
Well, I would use that year parameter. I mean, it doesn't have to be that way. And I'm not going to put it an absolute thing, but if, your messaging should be, yeah, like you lost your father, and that's a huge thing in people's lives. So you keep it pretty gentle, So yeah, if they're saying like, yeah, I just feel like I'm not in my body, I've gone numb, I'm depressed, like, okay, well, let's do a little bit of this and that. But I wouldn't do that in the first, I don't know. I mean, personally, I prefer not to do that in the first 6 months. And I'm definitely more comfortable after a year. I've had losses in my life, and I understand it enough to know I don't want to give someone the impression that I have something to offer that's going to be particularly more useful than time. But it doesn't mean you can't work with someone. There's no real, depends how they present. Someone comes to you after 3 months and says, my partner died, I'm in a grief process, I have 2 kids, and it's like a true story, and I need some things so that I can function, and here's how I'm feeling in general. Like, I took that client, because same kind of thing. Like, here's some breathing techniques, here's some embodiment techniques that might help. Like, here's, some stuff that might help you sleep. Here's, you're not doing anything wrong, but this person's like, I'm not functioning well. And normally, without the 2 kid factor, I might be like, yeah, you'll be okay. Not you'll be okay, but like, yeah, of course, like, this is a horrible thing. But this person like had to work, and they were sort of asking for help from that angle. It was a little bit less about getting them somewhere with their grief and just more about keeping them functional so they could do the things that they absolutely had to do. The issue with any like kind of mental health thing, whatever it is that you're getting cut off, right? From a yoga point of view, you're getting cut off from different parts of yourself. Your awareness is too narrow. And so sometimes introducing things that, give the person the ability to feel that thing they haven't felt in a while can be really helpful. Yeah, so she's healed, and so it would just be a matter of finding out what her status is, because lots of things can happen with scar tissue and such. But most people are okay after a year. Sometimes you get a lot of sort of scar tissue and sort of fascial repatterning. I mean, the main thing with that is that they're cleared to be doing stuff, which at a year you would be, but that's the thing you'd want to know, because everything else still applies. It's not like they removed muscle. You're just working with the same muscles. And often, with anything that's so like a big surgery like that, like you're going to have just on a physical level, right? Like they don't really rehab you like you think they would, but they don't really, often they don't do anything. So people stop using muscles in the way they were using them. Of course, you carry yourself different, right? Because now your body's different. So all these things have happened. So like, you're actually a really good person to work with at about that time, sort of get them back to moving around the way they want to if they haven't done that yet. It's kind of sad. It's another one of those things that where they're like, we're done, you're fine, high five, you're gonna have to decide like how you're gonna work with her, right? Like, where you're gonna go first. You could say, okay, let's do a bunch of physical stuff to get your body where it needs to be, and then we can tackle, like you're saying, more like Vajnana Maya Kosha issues. You could think of it that way. You could think about the whole thing as an embodiment exercise, right? Where, I'd probably be pretty curious about if I could get her in her breath and in her body, maybe doing a body scan, if we could make sort of progress on all fronts, getting her like really comfortable, right? Like, body wise. And then of course you have the Vijnana Maya Kosha world where you could give her meditations, but I probably wouldn't start there, or maybe something more like a yoga nidra, like dropping through the koshas. So it has a little bit more of like getting her all the way to her core might be a better choice, and then there's a sort of, you'd want to go about it all gently because she's had a hysterectomy and she might have a lot of like avoidance of, you know, I was thinking about like chronic avoidance, right? Of like all those lower parts of her body just sort of not feeling herself, you know, internally, like with her mind. So I would go slow. That's my point.
Yeah.
I would go very slow, just to let her kind of reacclimate.